My name is Ebony Marcelle. I've been a midwife for almost 14 years, working in Washington, D.C., and I'm also a new mother. I feel like the U.S. is struggling with its maternal mortality worse than other developed countries, primarily because of the fact that we haven't had the discussion about the effects of racism. This is not a new problem. It's a very old problem. We're not broken. We don't need to be fixed. Our systems need to be fixed. Our maternity care options need to be improved. And also, we still have a medical system that believes a lot of race-based myths. So, Black women have different pain tolerance, that, we're always perceived to be angry, difficult to communicate with. And so that all plays into on how we're engaging in care and what our experience looks like. When we think about not just Black women, how other ethnicities are also impacted by this, there's great research looking at, for an example, first generation Mexican women, looking at the fact that Mexican women who have not lived in this country have rates comparable to white women. But as every generation continues to be in the US, their rates worsen, right? And so absolutely, you're going to see it amongst any of the ethnicities and populations that have been oppressed or had to deal with chronic racism, aka stress. The problem with medicine is we keep wanting the patients to do the work, but we need to do the work to be more trustful so patients will engage. And so the access is really layered, right? We're talking about location, we're talking about access to particular providers, access to where you can give birth, and then what access you may have if you live in an under-resourced area. So it's very layered. Healthcare providers can start to address inequities and discrimination in whatever setting that they're practicing in by partially working for organizations that it's at their core. It's at their core mission to address this by doing the work themselves, not feeling like they have a pass and that they have to do the work. Everybody has to do the work. And it's important to really acknowledge the power of cultural congruency in care. Seeing someone that looks like you take care of you. So we need more providers of color. Trainings, there are definitely different organizations that are offering trainings to help with organizations. But, again, it has to be a commitment that this is an ongoing practice and that it's going to be forever. And that really starts with leadership all the way down.